Okay, this video is the newsletter about Dr. Walter Kempner. This newsletter was written by Dr. Mcdougall. It comes from his YouTube channel. I'm sorry, it comes from his website. You go to drmcdougall.com, you can read this newsletter. It is the newsletter from December 2013 by Dr. John Mcdougall at mcdougall.com. So I just want to share it with you, though, because a lot of people, they don't know the true story about Kempner. In Dr. Mcdougall's words, Kempner is the father of nutritional modern diet therapy, and he's the creator of the rice diet. He lived from 1903 to 1997. He had grown up in Germany, and he was a student in the research lab of Dr. Otto Warburg, who won the Nobel Prize in 1931 for discovering the Warburg effect. He also had been a nephrologist, so he knew a lot about the kidneys. And he began working at Duke University, Durham, North Carolina in 1939. And it all started out when he had this one patient, a 33-year-old lady came to him with chronic kidney failure, and he told her, just eat a rice diet for 2 weeks and come back. He was too busy to spend more time with her that day. And she misunderstood him and came back in 2 months after eating just about only rice, and she was in dramatically improved health. Her blood pressure had gone down from 190 over 120 to 124 over 84. She had resolution of her eye damage, retinal hemorrhages, and papilledema, and a decrease in her heart size on chest x-ray. And Kempner had heard about, read about the Asian patients, everybody in the rice-eating Asian countries is skinny. And so he began to study how to use this, and with his previous nephrology experience, figured out that this would be a way he could save a lot of people's kidneys. Dialysis itself did not become widespread until about after 1972. So in the mid-1970s, Medicare started insuring it. It started becoming common. But before that, these kidney failure patients, a lot of them, they just die, okay? There was nothing else you could do. And some people were trying things about how to get a low-protein diet, but it's more than just lowering the protein. You also want to make the diet alkaline. So, fruits and vegetables are alkaline. Meat is acidic. Meat's the biggest acid load, all that animal protein, so you want to minimize that. Walter Kempner also wanted to minimize sodium because it's a vasoconstrictor, inhibits endothelial nitric oxide, and you decrease blood flow to the kidney. When you eat a lot of meat, the animal protein also causes hypertension within the glomeruli of the kidney. So sort of an intrarenal, intranephron hypertension that's damaging to the kidney. It also turns out that the more saturated fat that you eat, the more proteinuria you get, the more protein shows up in your urine. It'll increase the permeability of the glomerulus membrane, and you'll get more protein in urine, which is bad. You're losing albumin into your urine. And the faster you lose albumin into your urine, proteinuria, the faster the kidneys fail. So that's all bad. Let's see. The other thing Dr. Mcdougall points out here is that, as simple as it is, the rice diet. He had better results with the rice diets than any drug or surgery ever in the history of the world has achieved for coronary artery disease, for heart and kidney disease, kidney failure, for hypertension, diabetes, arthritis, and obesity. There also weren't any good hypertension medications back in those days. They would do fancy complex surgeries like a sympathectomy. And so Kempner specializes in taking really severe hypertension and kidney failure patients and curing them. So Kempner began to, follow his patients and keep track of, their results. What happened to their kidney function? What happened to their blood pressure? What happened to their retinal eye exam? Let's see. The most serious patients, end-stage kidney failure, malignant hypertension, those were all inpatients monitored very carefully. And he did monitor his patients. They would come and stay in Rice House apartments, and he would make rounds on them every day. First of all, they'd go to the Rice House in the morning. They would weigh themselves in public. Then they would have their labs drawn. They would eat their meals and chat with the other rice patients. And then Kempner and his staff would come by, see him later in the day. He cured lots of patients of psoriasis, autoimmune disease. The average total cholesterol at starting was 273, and it went down to 177. So it depends on how long that took. You'd often get a much lower than that. But what he had dramatically shown was the best diet for curing diabetes was a high carbohydrate diet, which is the opposite of what a lot of people have thought. He routinely cured type 2 diabetics. I've actually heard Dr. Mcdougall say one time he cured all of them if they truly had type 2. Okay, now here is some of his fat patients. He published a paper where he had 106 patients lose over 100 pounds. The average weight loss in this group was 140 pounds. So he had tons of these patients that lost over 100 pounds of body weight. Rice is only 1% of calories from fat. The fewer the number of calories from fat, the faster the patients lose weight. He would also supplement it with table sugar because the advantage of table sugar, white sugar, it's basically just fructose and sucrose and fructose, 50-50 of each. There's no fat in there. There's also no nitrogen to mess with the kidneys. There's no fat to cause hypertension. And like I said too, fat also is damaging to the kidneys. All right, so here's just a typical blood pressure. The patient starts out with a systolic of around 200, a diastolic of 120. So 200 over 120, it's a high blood pressure. Puts them on the rice diet, and within a couple months, they're down to, you know, this patient's like about 130 over 87 or something. All right, so anyways, that's just typical kind of results they were getting with the rice diet, and they would often simultaneously see healing of their hypertensive retinopathy in their eyes. And it's rather amazing. So they have an ophthalmoscope, and they first show all these injuries and lesions and small hemorrhages. And the patient, after, this was a couple years, the eyegram looks dramatically normal, virtually normal. Okay. You can resolve the diabetes and the hypertension. He had lots of patients reversing their EKG findings, indicating that they were reversing coronary artery disease. Okay, they no longer would have abnormal findings like inverted T waves, for example. He also had many patients where their heart would shrink on the chest X-ray, suggesting that they were resolving congestive heart failure. And also, some of these patients had fluid overload from kidney failure. The kidney was unable to excrete the fluid. There was no dialysis. So this is rather extraordinary stuff. I've gone through the Kempner book. I've gone through the book written by the lady who worked with him. It was quite good. Here is just showing you the diet of, like, here's an ordinary diet. Lots and lots of fat, standard Western diet, lots and lots of protein. And you really want the opposite. Americans don't tend to realize that, but you really want to get your protein as low as possible. You want to get your fat as low as possible. It's impossible to be too low in fat and too low in protein for any regular person on any regular chosen diet. There's rare special situations where you'll want more. Like, let's say you have a large open wound and you have to heal it right away. It's just a new fresh wound. You'll want a little more protein in that instance. But for a regular person, human breast milk is only about 5% protein, and that's our most rapid phase of growth. So we need less protein than that all the other times of our life. So, it's hard to get less than 5% protein. Sweet potatoes are about the lowest amount of protein and starch, 4.5% of calories from protein. Papua New Guinea, they used to eat 93% of the calories from sweet potatoes. They're a bunch of muscle men. Okay, so you get plenty of protein. And there's a lot of hypo. Well, you don't want to be below your RDA levels of protein. And I think that's totally exaggerated. Plus, I can tell you, there's also been shown that low protein diets, just low protein, around 0.6 grams per kilogram per day, they actually don't work so well for kidney failure patients. You start getting more significant improvement when you go to very low protein diets, which are about half that amount, like 0.3 grams of protein per kilogram of body weight per day. Okay, so look at Kempner's now. It's incredibly low in fat. It's incredibly low in protein, and it's almost entirely carbohydrate. The amount of protein was only about 4.5% of calories from protein, and there was only about the amount of calories from fat was something like 2.5% of calories from fat. That's extraordinarily low. And then the rest, 93% in that ballpark of the calories came from carbohydrates, from the rice and from the sugar, for example. It's quite extraordinary. So again, the reason why he liked table sugar was because there's no protein in it, no sodium in it, no fat in it. He would not allow any nuts, dates, or seeds, okay? So you want to protect the kidney, this is all good. And protecting the kidneys is a big part of staying healthy. Okay, what else do we say over here? He encouraged them to exercise. I remember here, I'll get myself off here. I remember all these patients. I read several books of patients who had gone out there. They would walk around a lot in Durham, North Carolina. He did give vitamins to them. More than he needed to. Like if you have the Mcdougall diet where you're eating whole foods of starch, Dr. Mcdougall says you don't need to take anything except vitamin B12 cobalamin. He went with white rice because he felt it was more palatable, and more than half the world population at that time was eating primarily a white rice diet all over Asia. And what you're basically doing is getting all the toxins out of the diet, like the animal protein, the saturated fat, the cholesterol, and you're letting the body heal. You're sort of getting out of the way of the body. The rice diet was phased out at Duke in 2002, and then Robert Rosati and Frank Nealon continued to work with it for a while, but eventually that was phased out in 2013 as an independent thing. There's just not as much money in this as there is in drug therapy. Yeah, so he had about 2.5% of calories from fat. That's incredibly low. Fat has only 1% of calories from fat. Same as potatoes and sweet potatoes, only 1% of calories from fat. That's extraordinarily good. He got the sodium down real low, in the ballpark 150 milligrams of sodium per day. I'm showing you all this because you need to know that this is what can be done, and this is how low you can go safely. His patients did great. They monitored him. They weren't having any problems. He did have to monitor. Some patients would drop their sodium too low if they had really bad kidney failure and a problem with handling sodium, but those were the rare exception. This is Robert Rosati and Frank Nealon. They've got videos of them, and I think maybe his wife as well, Kitty Rosati, on Dr. Mcdougall's YouTube channel. So anyways, this is, the story of the rice diet, and it's good to know about it because this is, the foundation of nutritional medicine. And once you know about this, you're not going to get tricked so easy by, paleo, keto, carnivore, low carb, and other nonsense. So hope that was interesting for you, useful.